Now, the failed insurrection could lead to another surge in COVID-19 numbers. COVID-19 protocols were breached in the last week as thousands of people went on looting sprees in Gauteng and KwaZulu-Natal. The country has recorded close to 16,000 COVID-19 cases in the last 24 hours, and more than 400 more people have died from the virus. Exactly where are we today when it comes to the third wave of this virus? Let's discuss these numbers now and the possibility of another surge in the near future with Professor Adrian Puren, head of the Center of HIV and STIs at the National Institute of Communicable Diseases, that's the NICD. Prof, thank you very much for your patience. You've been waiting for quite some time while we were going around on the ground in the capital city there, looking at the work that's being done by the Defence Force, the police and the local Metro Corps there in bringing about peace and stability and ensuring there's no violence in the capital city. Now, COVID-19 numbers. We've all witnessed the nightmare of the past week in the country. We saw thousands and thousands of people, young and old, without masks, and people gathered, and we know that gatherings are not even allowed here, but there was no control. The numbers are not looking good just in the last 24 hours. 193,338 active cases in South Africa, 413 deaths, 15,939 new cases reported in the last 24 hours.
Yes, Dan. So, of course, the concerns remain, in particular in Gauteng and in the Western Cape, in terms of the numbers that we are currently seeing. But as you quite rightly say, because of the events, I'm sure that there has been disruption in terms of individuals trying to seek out testing and or care. And in fact, seeking out care and being tested, I think, may well be a major challenge, and that may continue for a while. It just depends on the area and whether or not for example, transport systems, logistics, and so forth are in place. In addition, of course, in particular, I think in KwaZulu-Natal, I think, again, when you look at that trajectory, although it's deceptive, I think, because I think that there's been a great deal of disruption in terms of either people reaching hospitals and or facilities for testing and care, but in fact that the declines that we're seeing there may not be a true reflection of what is actually happening, and therefore you're quite right. It's not simply because of the events in terms of what could certainly occur there, but also because I think people have not been presenting for care and attention and testing. But nevertheless, the numbers still remain substantially high, although Gauteng certainly seeing a decline. But I think we need to just be cautious what those numbers mean. Similarly with Western Cape, I think there seems to be hints of a so-called plateau. But I would, again, because I understand that there are disruptions in the Western Cape as well, that those figures need to be treated with caution. But I think in particular, KwaZulu-Natal.
Yeah, and Gauteng, let's just start there for now. Normally, you tell us that there's a 2 to 3 week lag in picking up the numbers as people, it takes that kind of length of time to pick up new numbers. Can we anticipate another spike or surge in the Gauteng numbers? Let's just focus on the areas first where there was looting and violence and social disturbances.
Yeah, it's a difficult question to answer, I think. It's not always that straightforward, and it depends, as you quite rightly say, in the context in terms of people in close contact, although it's in the outdoors where you do expect some level of movement. But again, if there's close contact, loud voices and droplet spread, no mask wearing, close contact, mingling, then yes, we may well see a surge in cases. But again, you can't always ascribe that particular surge to those specific events. I think it's very difficult because, again, we're not testing those individuals and we're not tracking those individuals. So it makes it very difficult to ascribe sometimes whether those events or spikes and surges are really attributable to the events that you're currently seeing on your television screens. But it is a possibility that we need to take into account.
Yeah.
My other concern is the fact that people are not going out for testing. So in other words, people that are really unwell, who do need care and attention, are not being presented and not being tested. So they may present late. In other words, therefore, we may see those particular surges as well.
Yeah, from a scientific perspective, I just had a thought now, and I'm asking you, could we see an anomaly in the trends, in the model, or as you said, we don't know?
I think it's difficult. I think that some of this, what we're seeing, I think in particular when I look at the numbers in KwaZulu-Natal, I did not expect to see a decline. In fact, we did not predict a decline that we're currently seeing in terms of KwaZulu-Natal. So therefore, my sense is that those numbers, it's deceptive to think that we've reached peak in KwaZulu-Natal and that it's coming down. So I think we really need to watch and see over the next few days whether or not, because I think we are aware of the consequences of this disruption in terms of people, as I said, not being presenting. And of course, within the laboratory setting as well, people are unable to get to the laboratories to do the testing, and or the, reagents not being available because of logistics, or specimens not reaching laboratories for testing. So I think there are multiple factors that are probably affecting those numbers that we're seeing. I know that antigen testing, which does not require sophisticated laboratories, especially in the KwaZulu-Natal, have been rolled out. So that may be some way in which those numbers can be sustained in terms of testing. But again, it's not clear that is entirely the case. Because again, PCR certainly contributes. That needs laboratory setup. So if that whole system is disruptive in many ways, that we're not seeing the levels of testing that we would ordinarily see in KwaZulu-Natal.
So, Prof, it's not easy to answer the question, will infections rise because of the unrest?
Yeah, so directly within that context, I think it's very difficult to do that. I think people have looked in various studies, for example, where people have congregated under those circumstances, not circumstances that we've seen, but certainly close contact, not wearing of masks and so forth. And it's very difficult to really predict whether or not you're going to. It's likely that you will, but you can't really say definitively that you will. I think my concern is the fact that people are not being able to, who would ordinarily present for testing, do not have the opportunity to present for testing, and that's a major concern.
Yeah, a few weeks ago, we were anticipating, from what we've been told, that the third wave in Gauteng will spike and begin to turn or flatten. I don't think flatten, but begin to turn, with the numbers declining towards the end of June or early July. Where are we at right now from what you are seeing? Are we still at the high levels of the third wave in Gauteng and places like Western Cape and Free State examples and the Northwest? Where are we?
Yes, you're quite right. So I think the peak for Gauteng has probably been reached again, but I think I don't think the disruption of testing has been to the extent possibly as in KwaZulu-Natal. But again, I think we just need to keep an eye out on that. But you're right, when we look at places like Limpopo, Northwest, Mpumalanga, Western Cape, those are still provinces of concern because the trajectory is upward. Is certainly going up. But again, I think the Western Cape in particular, again, I think one would be cautious because there may well have been disruptions in terms of testing patterns. So again, let's just keep an eye on those trajectories in those four provinces. Certainly, the deaths and hospitalizations are still on the upward, but you're quite right. That's a lag that we're currently seeing, so the lags may well continue.
Yeah, Prof, finally, we got another week, or a little bit over a week, of the extension of level 4 lockdown restrictions, I think to the 26th of July, if my memory serves me right. At this point, the President extended it to the end of the month. Are you hoping that we'll see that also playing maybe a positive impact with the extension of the level 4 lockdown restrictions?
Yes, I'm hoping that overall that these particular approaches in terms of restricting movement. So in fact, one of the paradoxical events in terms of these current disruptions, in fact, is that there may well be limited movement as well, or restricted movement, and that may well contribute to a decrease in the numbers. So I'm hoping that certainly will contribute in terms of the current readjusted levels to seeing a decline in the actual numbers, especially in Gauteng and Western Cape. But of course, the provinces of concern are in particular Limpopo, again, where you have still remarkably high positivity rates. I think there, again, it's really encouraging increased testing to really get a good sense of what's actually happening in Limpopo and, of course, in Mpumalanga as well.
Yeah, it looks like the third wave is still going to be with us for pretty some time. Thank you very much, Professor Puren, for giving us your time on this Saturday afternoon.